Hi guys, I'm Danny West and you're back with another episode of the Soapbox, your patient education station. So today we are talking physio first aid for the elbow. Okay, so the elbow is not always the elbow, okay? Mind-blowing spoiler alert there. I find whenever someone comes in with the elbow, I am absolutely going to the neck first. So our last soapbox, we talked about physio first aid for the neck. Well, rewatch that one, especially if you're getting elbow pain, because actually some of those techniques can help alleviate the elbow symptoms. So I'll review a few of them today, but again, this isn't meant to be in lieu of getting your elbows checked out by a healthcare practitioner. It's just, again, if you start noticing some elbow pain, what you can start trying to kind of get a jump start on a few things. So elbows, if we keep it as simple as possible, you can either get elbow pain right on the outside from a lot of repetitive motions, or you can get some pain even on the inside. Of course, there's other things. If you fall on your elbow or fracture it, that's again something else. This is mainly for that outside elbow pain or even this inside bony bit as well. Okay? So the first thing I'm checking is the neck, which should be something you're checking in yourself as well. So can I get my chin to my chest? Can I look up? Can I rotate my chin in line with my shoulder both ways? Can I do side bending both ways? So if you notice actually my neck is really stiff going a certain way, I want you to start with this Miss America pageant one. So all you need is a housecoat string. This is also on the neck physio first aid as well. But it's basically what's called a Mulligan Technique, which is a mobilization with movement. And so the neck has these little muscles in here called your scalenes. And they actually attach to your first and second rib. And believe it or not, your first rib is actually right here. It's quite high, and then that's where the lungs sit under. So let's say I'm stiff. Let's say I'm stiff going that way, even though I'm a bit better. But I'm going to demo it on this side just because my mic's on this side. So I call it the Miss America pageant one because you literally would tie your housecoat string like a sash across kind of the nape of the neck. And so if I were to stand, what I'm doing is I'm actually giving a push down on an angle, and I'm going to hold that pressure. And there's two versions. You could either side bend towards the belt 10 times, or you can add pressure and side bend away. And this gets more of a stretchy feeling, more through the muscles, whereas this way might help the joint a little bit more. So they'll both benefit. Again, you could try one set of each, and then when you're done, kind of take that off. You're going to retest your neck range of motion and just notice how it feels a little freer. And if you did that consistently, maybe once a day, I beg to ask, how does that elbow feel? Because even that can start alleviating some elbow pain. Why? So the little muscles in the neck, they act like curtains. Okay, so there's three little curtains. There's just anterior, middle, and posterior scalene. And through those, if you looked at an anatomy book, it's actually where a lot of the nerves come out of from our neck. They go under the pec and they go all the way down, and some of the branches actually go in through the elbow. So even though we're feeling the pain here, the root cause can be up the chain. So the first thing I always check is neck range of motion. So you can do Miss America pageant. The second one you can do is a pec opener on the foam roller. Okay? And so again, this was for the shoulder first aid. There's a foam roller sequence that you can do. I'm just going to show the one movement, but you could do that full shoulder blade sequence on the roller as well if you go to physio first aid. So I'm just going to switch my view here. All right, just so you can see me. And this one is called your snow angels. So I'm going to lay on the roller long ways. It's nice because my head can just relax, and I'm just going to start with some snow angels. You can lay in a T, but I like more of a dynamic stretch if I can over a static stretch. So I'm going to go up and down. And what this is doing, again, it's taking the tension out of the neck, but also opening up the chest and these pec muscles that can be affecting the elbows. So I'm going to do that. Again, the more the better, maybe 10, 15, 20, but all throughout the day. And ideally, the back of your hands should be able to stay touching the floor, but they might start to hover up on one side, especially if one side is tighter than the other. So snow angels on the roller is my second go-to. And then my third go-to is some trigger point work on the actual elbow. So again, start with the neck range of motion, the little Miss America pageant. Then go into the shoulder openers. If you've done that for a couple of days and you're like, nah, I'm still kind of feeling it in through the elbows, and you've been doing it consistently, you can go straight to the source. So if there's pain on the outside, you can kind of feel like up through here, it's nice and meaty. You can kind of dig your fingertips in and be like, ooh, that's a little bit tender there. So you want to use the pads of your fingers, hard if you have nails, but kind of stay close, not the bone, but just below, and try to find a little sweet spot. And you'll know what I mean if you've been having some elbow issues. And then once you find a spot, I want you to test each of your fingers. And just notice, is it more intense when you lift the pointer finger, the middle finger, the ring finger, me it's my ring finger, or my pinky finger? And because all of your finger extensors originate here. And what you can do once you find that spot and you find the finger that it matches, you're going to do that, lift that finger 10 times. And that's a way to kind of self-release the muscles that are tugging on the bone and causing some elbow irritation. Okay? So again, I just do a set of 10. You can maybe do your typical kind of forearm stretches after that. But just getting a little bit more specific instead of just rubbing it all the time. Again, I always finish off with, you can cup that. You can put a cup on right on the meaty bit, not on the bony bit, and leave that on for about 5 minutes. If you're getting more elbow pain on the inside, I would put the cup just below the bony part on the inside. Okay? So those are my top 3 go-tos for any elbow issues. Neck, loosen up the neck in the first rib. Second one is shoulder openers on the foam roller. Third thing, you can go straight to the source and self-trigger point, especially if you have elbow pain on the outside, or cup, okay? And then, yes, your typical elbow stretches. So that's your physio first aid for the elbow. But yes, definitely check out the neck stuff and also the shoulder episode to see what else you could maybe do in addition to that until, again, you get it properly assessed. Okay? So thanks, guys. That's the Soapbox for today, and we'll see you next time.